Welcome to our live stream event tonight. My name is Jackie Sitton, and I'm a family nurse practitioner at Lifeway Health. First, I want to give you a little bit of background about who I am. I worked in the emergency department as a nurse for 2 local hospitals for about 16 years. During this time, I saw so much chronic disease, such as heart attacks, strokes, uncontrolled high blood pressure, complications from diabetes, and many, many more things. I loved being a nurse, but I really wanted to do something more to really help prevent disease and help prevent people, if at all possible, from ending up in poor health. So I began to shift my focus to primary care. I graduated from school as a nurse practitioner and then started working in primary care with a specialty in pediatrics. While working in primary care, it was what you might consider a more traditional style of medicine. I felt like practicing medicine was just not as personalized and didn't give as many options as I thought there were that patients and their families may want to choose of how to take care of themselves. I felt like it was an algorithm-based way of treating patients, the disease focus, not the patient focus. So I decided to go back to school again for functional medicine. A lot of people do not know what functional medicine is because it's a newer concept. It's a newer way of practicing medicine. And it's truly going to be the future of the healthcare system. Functional medicine looks at what is the root cause of disease. So for example, hormones, poor sleep, stressful relationships, exposures to toxins and chemicals. All these things can affect whether we develop high blood pressure, heart disease, diabetes, strokes, anxiety, depression. So in the traditional model, I find that most of the time when someone presents for an appointment, they're usually given a prescription to treat the symptom, to treat anxiety or to treat depression, to treat their high blood pressure. But functional medicine looks at the deep root cause and says, is there something that we could do to restore health so that you don't have to be on these medications for a long period of time? I personally believe there's a beautiful blend of both models, and that is how I practice. I believe that there's a lot of work that we can do digging at the root cause for functional medicine, but I'm also not opposed to prescribing medications because in certain circumstances, I believe it is necessary and we should utilize what we have. But did you know that most insurance plans will cover some degree of functional medicine? They cover some lab testing, they'll cover the consultation most likely, and even sometimes cover health coaching, which is a huge benefit that I feel like a lot of people are not aware of. There are tests that insurance may not cover because some of these tests are not mainstream, but they are extremely beneficial. And I truly believe that in the future, we will start to see more of them being covered. And some of these tests include DNA testing for what is your metabolism? What type of diet should you be eating to be at your best, most healthy weight? What type of exercise is going to be beneficial for you in preventing obesity and diabetes? Hormone testing, do you have abnormal levels of progesterone, DHEA, testosterone, cortisol, melatonin? All of these things can actually be measured. We can look at heavy metal testing. Do you have an exposure to a heavy metal that has built up to toxic effects and it's causing neurotoxicity? We can look at that. Neurotransmitter levels. If you're struggling with anxiety or depression and have just not found the right treatment to help you feel your best, we can actually measure those levels in your body so that we can pinpoint exactly what supportive nutrients that you might be lacking, what alternative treatments that we can do to help alleviate anxiety and depression, and or pinpoint what medication might be the best and most effective for you. So what I'm going to do is I'm going to give you a few examples, something that you yourself may be struggling with, or best guesses are you're going to know someone who is struggling with one of these conditions. And so I'm going to talk to you about what the traditional model of medicine usually looks at for these conditions, and how we might view it with a different lens, and what are some of the testing or what might be my approach as to how we're going to address that symptom or that disease process. So first, let's talk about the gut. So the gastrointestinal system. Most people I find are on some sort of reflux medicine or Miralax for constipation, because in America, I feel like our guts are a mess. So most likely you've been prescribed an H2 blocker, a proton pump inhibitor, like I said, Miralax, or some combination of medications to help put a Band-Aid over the stomach pain or the dysfunction that you are experiencing. So if you come to see me, one thing I may suggest is we might want to start to look at, are you sensitive to any foods that you're eating? There are very healthy foods that may not agree with your body. And if you're eating this healthy food that is causing inflammation in your gut, then it's actually could be more harmful than it is good. So this is one way that we really personalize your care. Rather than saying, here is a great diet plan, this is going to help you be healthier, this is going to help you lose weight, this will help you feel better. A lot of people come to me and they're like, I'm already eating healthy, but I can't lose weight, or my stomach still doesn't feel well. What's that missing piece? And I have found so many people find a food sensitivity that they had no idea. Because over time, as you expose your body to that food over and over again, it can be a very delayed reaction. So it could be hours or days before you start to notice symptoms, which makes it really hard to go back and say, what was it that I ate that has made me feel not so good? So we may look at food allergy testing or sensitivity testing. We can do a test called the GI Effects, and it's a stool study that looks at 5 major areas for gut dysfunction. Some of those include maldigestion, like you're eating food, but your body doesn't have enough digestive enzymes or chemicals to break down the food so that you can absorb the nutrients. It looks at gut dysbiosis. That's a word that you may or may not have ever heard before, but basically that means the ratio or the balance of good, healthy bacteria in your gut and bad bacteria in your gut, the good and the bad bugs, are not in good proportion to one another. There may be more bad bacteria than there is good, and so we've got to fix that. There could be parasites in your gut that you're unaware of. There could be candida overgrowth. There's multiple things that we can look at. That test actually tells me what good and bad bacteria are in your gut, so we don't have to guess. When you go to the pharmacy and you look at the whole shelf of probiotics, and they all have different strains of probiotics and different levels of them, and that's one of the questions I get asked the most is, which one? Well, instead of guessing, we're able to say, well, you are low in these 4 probiotic strains. Make sure that you supplement with a probiotic supplement that includes those 4. So it kind of takes the guesswork out. So it's really personalized to you and what your gut needs. The root cause is something that we have to get down to because we need to heal the gut. There's so much important processes that go along in the gut that just lead to overall well-being or overall not feeling well. It's really important to come off of the acid reflux medicine, if at all possible, because like I said just a few minutes ago, is your gut needs acid to be able to break down food appropriately. We just need it to be in the right place. Some of the things in the nutrients that you may not be absorbing well are calcium, folic acid, your B vitamins, iron, magnesium, and vitamin D. Most Americans are vitamin D deficient, so that's something that we work at, is getting the gut in good health so you can absorb all of those nutrients, because you need them for overall well-being. There's a strong connection between the gut and the brain. This is something that research very recently has shown a very strong correlation to. Gut inflammation is directly linked and directly tied to anxiety and depression. So a lot of the mental health disorders that most Americans are feeling right now we need to do the digging or the root cause disease in the gut before we just treat a medication that will help increase those levels in your brain. Anxiety and depression can be such an arduous process also in finding the right medication. So the neurotransmitter test that I mentioned a few minutes ago is a great way to go. If someone comes to me and says, I've been on 6 or 8 or tried 6 or 8 different medications and I can't seem to find one that works for me, well, let's take the guesswork out of it. There's DNA tests that will tell me exactly how you metabolize certain drugs that will tell me, are you an under metabolizer, an over metabolizer, or a normal metabolizer, so that I can not only pinpoint the medication that would work best for you from the neurotransmitter test, but at what dose or at what strength so that you will experience the least amount of side effects. So these are some of the things in functional medicine that we can do to really help personalize your care to help you feel better. Okay, do you have chronic fatigue, headaches, weakness, memory loss, ringing in your ears? These are all symptoms that can be a result of toxins, neurotoxins. So neurotoxicity is a term that can result from exposure to multiple different things, but it could be from chemotherapy, it could be from radiation, it could be from different drug therapies or regimens, it could be from an organ transplant, but it also could be from exposure to high levels of mercury, lead, certain food additives, things of that nature can, like pesticides, industrial or really potent cleaning products. Right now, everybody's been cleaning with the most potent products to kill COVID. So some of the side effects from that could be developing a higher level of neurotoxicity. Cosmetics also could attribute to that. So functional medicine approach to that would be, let's test for heavy metal toxicity, and then let's go through the detox process and see how you're feeling after we go through that process. Here's another example. Do you or anyone you know of experience or are dealing with eczema, asthma, allergies? Chances are, yes. All 3 of these conditions have root cause of inflammation. They are linked together, that if you have one, there's a very high percentage chance that you're going to also have another one of these 3 symptoms of inflammation. Did you know that taking Tylenol is directly linked in studies to increase your risk of developing asthma and eczema in children? These are some of the things that we can talk about, and how do you treat fevers in children with avoiding Tylenol. So once we go through the process of eliminating all the inflammatory triggers, then a lot of patients can come off of their daily asthma or allergy medications or even eczema medications. Part of that process is removing sugars from the diet. Taking a probiotic, Lactobacillus rhamnosus has directly been linked in studies, especially with children, and in pregnant mothers who take this in the 3rd trimester, of a much decreased level of asthma and eczema in their children. So there's lots of things that we can talk about to help people who are suffering from asthma, eczema, and just overall inflammation. So I hope these examples have given you or started the thought process about how you might be able to look at medical care with a different lens or from a different angle, or even just open up the thought process of like, I didn't know these tests were even available. Like, let's dig down deep together and figure out for you what may be one of the root cause of your symptoms. However, I am going to tell you that digging deeper, number 1, it takes work, and number 2, it takes time. So I always talk with patients when we start this functional journey is that it is a journey. Like, it is something that on average will take at least 3 to 6 months, if not 12 months, to discover what is the root cause and then try to reverse that, or fix it, or alleviate some of the stress, or get the hormones back in balance, get the gut back in balance. It takes time. I also use the description or analogy of like peeling back the layers of an onion. I may not be able to get down to the root cause in the first visit, but it's going to take time. And as we heal one area of imbalance or inflammation, then it will give us a chance to look at another area that we can improve on until we finally reach your goals. So it takes time. it can be easier to start a medication and feel better right away, but just know that there's a possibility you may have to take that medication for a long time. And so I talk to patients about those two options. And sometimes it's best to start a medication while we are digging deep. And I'm okay with that. Together, we work to find what's going to work best for you. So my goal is to make sure that you can live your healthiest, most fulfilling life. And at Lifeway, we really focus on that team-based approach. We have health coaches here who walk with our patients every week or every other week on this journey because, like I said, it's a process. And I don't want you to feel like you are left on your own to try to figure this out. We have had a huge amount of success and stories from patients about how this has been just life-changing for them. They've never felt like they've been heard as much as they have here with our health coaches and our providers. They have learned new things about their body or new things about testing or multiple different areas of education that they have learned about how they can better their health. The success stories are incredible. So thank you so much for taking time to tune in tonight. I hope some of these examples have started to trigger some interest. You may immediately be thinking about, oh, I wonder what she could do for me, or oh, my sister or my brother or my child or my mother or father, they're dealing with this. I really want to get them connected. We would love to hear from you. So here's what I want you to do. I want you to comment under this live video, what is the one thing that stood out to you most in the talk tonight? Did you learn something new? Did you think about a different way to view your health? Have you ever heard of functional medicine? I would love to hear from you. The second thing is, if you want to schedule a consultation or you want to schedule a time to sit down one-on-one and see if, what we can do to work with you specifically, give us a call. Our telephone number is 828-761-1710, or you can email us at info@lifewaytoday.org. So please visit our website for more information. Again, all of our contact information is on our website, and that is lifewaytoday.org. Thank you so much for tuning in tonight, and I hope y'all have a wonderful evening, and I cannot wait to hear from you soon. Bye.